department engage in that. So that work is done.
And have other people been put into self-isolation as a result of that contact tracing?
Yes, so the procedure is clear. So any person who is a contact is asked to voluntarily self-isolate, and that has happened.
Now, every positive case so far has been treated in hospital, but can we keep this up? Could positive cases end up being treated at home because of capacity issues and because of the knock-on impact on the services that the hospital is there to provide?
Yeah, I think at this stage, Carol, while we're in the containment phase, isolating people in hospital is an effective way of containing. That is the position as adopted by the ECDC, the European Centre of Disease Control. So should the number, and at the moment that relates to 13 individual cases, should those numbers grow, then the position would be reviewed, because it's also, of course, we're aware that the majority of people can actually manage this condition at home, but we'll be guided there by public health advice and international advice.
And just tell us about our intensive care capacity. The 13 people who are in hospital, they're not necessarily in ICU, they're in isolation or under infection control. But as this develops, tell us more about our intensive care capacity.
So we have a national intensive care capacity across the country of 220 beds. That's growing at the moment by a further 25 beds. And that is used for treatment of people who are ill. And as you rightly say, most patients in the country at the moment with this condition are not in that space. So from our point of view, our capacity, which is, as you would be aware, over winter can be challenged associated with flu and other infections.
So most of those beds are probably already occupied. What happens if more are needed?
So the rate of occupation in our ICU beds is high. A recent report by NOCA, the National Office of Clinical Audit, would highlight that. In the event of needing capacity for this purpose, then we're looking at the kind of measures I referred to earlier, which would be, for example, curtailment of surgery, elective surgery, that will create capacity in our ICUs. It's not something we want to do, and it's something we will have to review really case by case over time.
The head of the HSE said yesterday that the winter beds that were added this winter, they're going to be extended to help ease that pressure. Is that going to be enough?
Yeah, so there were over 200 beds added additionally this winter, and of course on any day there are 11,000 people receiving inpatient care in hospitals in Ireland. So the question of sufficiency, I think we're going to have to work through this over time. Our contingency planning is about making sure that we have adequate space to provide the essential services that are currently provided, but also deal with this outbreak of viral infection. The challenge really, I think the answer will only become known over time, but our contingency measures are in place and will enable us to respond for quite some period of time.
Now, we say we're still in the containment phase, but Paul Reid saying yesterday that it will be a challenge to maintain this. This suggests that we could be about to move to another phase. What will that involve?
Yeah, so I think if there was a movement to what's referred to as a mitigation phase, then I think that is based on an acceptance that there is a wider community transmission. And in that event, I expect what we will see is more cases in our hospitals, but we will also see probably more people at home with the condition that they're able to manage at home.
Now, in terms of messaging, we hear on the one hand that the HSE is, quote, not alarmed, but on the other hand that this is, quote, a rapidly evolving situation. People will worry. What can they do?
Yes, I heard your earlier contribution from Age Action on this, and I think it's important to point out there is currently a helpline. So there is a phone number which is 1850 24 1850, and if we can clearly, if you can, well, I was going to say if you can put that on your website, will be helpful.
We will.
And the opening hours for that, just for the public, are 8 to 8 Monday to Friday and 10 to 5 on the weekends, and we're examining that in terms of load. If I could make one other observation, Carol, the 999 112 service is also receiving calls for information, and we would ask the public very much to target their calls for information to that 1850 24 1850 line, because of course we must maintain the 999 service for urgent and emergency calls.
OK, so that's 1850 24 1850. That's who you should be calling if you want information from the HSE.
And now, we have, I should add, live chat online for people who access online, and a lot do.
The HSE also announced a new policy last night for healthcare workers returning from an affected area, because there still could be people coming back from holidays, and this is in the light of the case in the west of the country where a medical professional is involved. Tell us more about this.
So the advice will evolve, I think, as the situation changes. And yes, you're right in saying that the position as of now is that Healthcare workers returning from areas of concern will be asked to voluntarily self-isolate for 14 days. And that's the position as of middle of this week.
Now, Paul Reid said that €20 million has been spent on equipment, ventilators and extra protective gear for doctors. Is this something, this procurement, that you have to keep an eye on? How far down the road are you looking when we're talking about this?
So in terms of procurement and supplies, the HSE has a group looking at procurement of all essential equipment and supplies, and there are measures in place already, including stocking up of certain essential supplies. So that will be something that, again, we will monitor over time. But right now we have measures in place to address making sure that our hospitals and community services have the equipment that they need to do their job.
And we know that teams are meeting today to discuss the whole issue of mass gatherings. When can we expect to hear some news on that?
So I think the policy on mass gatherings and its implementation will be a continuous piece of work, because there are many gatherings over time in our society. So I think later today there is a meeting of NEFIT, what's referred to as the National Public Health Emergency Team, and any guidance would emerge from there.
Do you expect that mass gatherings will be curtailed, or that there'll be new advice for people?
Well, the policy will create the criteria that allow for those decisions to be made. I can't articulate individually any particular one, but the policy is directed at that, and it will very much be case by case associated with the health risks.
Okay, and just as a final question, I know you can't talk about individual cases, but overall, how are the patients doing that are in hospital?
Yes, I think you rightly say, Carol, it would be inappropriate for me to talk about individual cases, but I think what I would point to is that the majority of people who acquire this condition will be relatively well able to cope with it in their home environment.
Okay, Liam Woods, National Director of Acute Operations with the HSE. Thanks for joining us. It's 8:24.
Let's stay with the virus and talk again to Professor James McInerney. He's head of the School of Life Sciences at the University of Nottingham. James McInerney, good morning again.
Good morning.
As you heard there in the interview with Liam Woods, and as we've been hearing throughout the morning, guidelines are due to be published today after a meeting on mass gatherings, and we've got one very big mass gathering coming up here right across the country, St Patrick's Day festivals. What do you think? Should they go ahead?
Well, there is an actual precedent that we can take a look at, and that's from 1918. You can take a look